Welcome, everybody, and thank you for joining us for this next episode of Aestique Plastic Surgeon's Secrets to Looking Your Personal Best. Today, we're going to be talking about skin lumps and bumps. Should I be worried? And with May right around the corner, May is Skin Cancer Awareness Month. With over 5 million diagnosed cases in the United States each year, skin cancer is the most common cancer in the United States. And it's also one of the most preventable cancers. So we're going to take a little digger deep and we're going to dive into it. So are you someone that has skin lumps or bumps that are concerning you? Do you have a mole that maybe has been changing shape or color? If you said yes to any of those questions, then this webinar is for you. We're going to chat about what to look for and how you can prevent it. Today's purpose, we're going to be talking about the types of lumps and bumps, signs to look for, types of removal, and frequently asked questions. Joining me again today are board-certified plastic surgeons at Aestique, Dr. Theodore Lazzaro and Dr. Linda Camp.
Hi, I'm Dr. Theodore Lazzaro of Aestique Plastic Surgical Associates. Thanks for joining us and hope you and your family are all well. Many people do not realize that plastic surgeons take off lumps and bumps as a common procedure. And they are also surprised to learn that it's covered by insurance. And we all know that there is going to be a fine line plastic surgical closure. So we enjoy sharing these thoughts with you today.
Hi, I'm Dr. Linda Camp, board-certified plastic surgeon at Aestique Plastic Surgery Associates. And today I'd like to kick off our talk about skin lumps and bumps by giving you a little quiz. These are going to be lesions that we're going to show you, and you kind of test yourself on what you think about these lesions. So our first picture shows an area of the lateral upper arm. It's about 1 inch in size. We talk about E when we look at a lesion. The border, if it's asymmetric, the color, the diameter, and whether it's evolving or changing. This one is about 1 inch in size, about 2.5 centimeters. It has asymmetry to it. Its border is undulating. This next lesion is one on the neck. It's also about 1 inch in size. Think about those features of A, B, C, D, and E. Our next lesion is one on an eyelid. This developed rather quickly, somewhat itchy. It's only about 1/2 inch in size, but developed a central ulceration. It is symmetric, its border is smooth, but it does have an ulcer, so the border is abnormal. It's a single color, but the diameter is big. This next lesion is one on a thigh. It's about 1 inch in size with some central scabbing. Again, we're looking at asymmetry, irregular border, multiple colors, a larger diameter, and it's changing.
Dr. Camp, just a question about this lesion. How long would it take for something like this to grow?
This lesion could be present for a very long time and not have much change when you look at it. However, when it's evolving, it can develop itchiness or some lumps or bumps about the border in less than a month. And this would be the E, or evolving and changing.
Very interesting.
These represent long-standing lesions that have been unaddressed. The one on the ear is about 1.5 centimeters or 1/2 inch in size. The one on the lip, also a little over 1 inch, about 2.5 centimeters. This one is on the right forehead near the hairline. It was just a little skin lump present for some time, but then developed this scab over the surface. It's about 1/4 inch, about the size of a pencil eraser. This one looks pretty similar in its size. It has the scab over the surface on this upper eyelid. Also new changes though with the scab formation. This is a very common thing that we see in very sun-exposed areas in patients with very fair skin. This is on the right temple. It's about 1/2 inch in size, a little bigger than a pencil eraser. It has a symmetric border, but it does have multiple colors. The size is a little large and it is changing. This lesion is on a shin. It's in a shaved zone of a leg, frequently irritated, recently been changing with getting lumpy, bumpy on the surface. There's a little scab at the bottom. This is a lesion on the back of an arm, one that you might not get to see very often, but maybe irritate when you're in the shower or putting clothes on and off. This is a posterior arm. It's about 1 inch. If you thought any of these were cancer, you were correct. And in fact, they were all basal cell cancers that were removed.
Just a question with that. One of the most common questions we get asked is, and I'll kick this to you, Dr. Lazzaro, does insurance cover the removal of these skin lesions?
Yes, well, it depends if there are certain criteria, like the lesions are enlarging or changing in color, frequent itching or burning. I can show you an example on this next slide where this young lady, she came in, and you can see, if you look closely, she has 3 areas on her face. One on her lower lip, on the crease between your lower lip and chin. One just above her right eyebrow in the middle, and one on her forehead that you can just see is almost a protuberance there. She was concerned that the lesion on the lower lip area was getting larger and darker, and was concerned that this could possibly represent a skin cancer, but also didn't like the fact that it was just plain there. So we decided we were going to remove that area, also the one over her eyebrow, and this lump that you had that we saw circled on her forehead. This was actually an outgrowth of her skull, where this had been present for years and slowly getting larger. We took these 3 areas off, and she asked if we can also do some freshening up of her eyelids, because she had a little tired look of the eyelids, puffiness of the upper eyelid, and what we call tear troughing around her lower eyelids that gave her a tired look. So we actually combined a cosmetic procedure, doing her eyelids, with taking off the lesions. Now here she is, just 3 weeks post-op, and you can see the trade-off for the small fine line scar that you will often see with a plastic surgeon, because this is what we do. We take attention to detail in getting as fine line of a scar as possible. Both the areas of her chin and above her brow and her forehead, these were all perfectly benign, were not dangerous. And also you can see the nice refreshed look she has around her face, with the eyelids being freshened up, and gives her a more open-eyed, awake look. The lesions were insurance covered. The other one was cosmetic.
Well, that's great to know that you can do a cosmetic procedure and tie it into getting rid of any skin lesions that you might have or might be worried about. Let's take a look at what happens to a basal cell if left untreated.
So this is a patient of mine. He was actually seen by his primary care and referred to ENT and to dermatology, who both were concerned about taking care of this lesion on the lower eyelid cheek margin. He was therefore referred to me, and this patient had started out with a small bump, or what he thought was a pimple, and left it unattended for a long period of time. It is not only the raised area that we see just under the eyelid, but the basal cell cancer he has also includes the flat plaque-like scar underneath the raised area. This did require a pretty large excision and actually a reconstruction of his lower eyelid and cheek margin. So the next picture will show that his post-op surgery at 5 weeks shows that he has very good eyelid approximation to the globe after the wide excision of the lesion. And on the right side, we see him 4 months post-op. So the plastic surgery reconstruction of that lower eyelid looks very good, almost wouldn't be recognized if you didn't realize that he had had a large wedge excision of that lower eyelid area. We'd like to do less than that, so we can take lesions off when they're small and not need to do such a big operation. This would require some skin screening and early concern about changing lesions.
Well, it's a really great result. It's so amazing to see that something that required that big of a procedure, you can't tell that you did anything only a few months later. So that's amazing.
Well, I'd like to continue our quiz with some more pictures. And again, test yourself about these areas that we're looking at. This lesion is on the thigh. It's also in a shave zone. You can tell it's been damaged a little with the scab. It's small in size, only 1/4 inch, about a pencil eraser, but it has some asymmetry to it. It's starting to get raised on the surface, shows signs of some pigment changes. Our next lesion, similar to my patient that I showed you, this lesion is raised, ulcerated in the middle. It's much larger and has been left unattended for a while. Our next lesion is in the upper inner arm, something you'd think just felt like a little bump. It's small, about 1/4 inch or 3 millimeters in diameter. It's symmetric, it's normal color, just maybe changing lately, getting a little firmer to touch. The next lesion is very common in sun-exposed areas of the face and forehead. This one is of the right temple. It's about 1 inch in diameter. It has some asymmetry to the border, some redness, some itchiness to the surface with flaking of the skin. This lesion looks kind of unusual. This is on a back, one you wouldn't be able to see by yourself. It's about 2 inches in diameter. It looks like a plaque-like light color change with these blood vessels in the center. It definitely is asymmetric with an irregular border, multiple colors throughout. The diameter is very large and it is changing, although if this were on your back, you might not be able to tell that it was changing. This next lesion is actually in a groin. Very delicate skin in this area, notable when taking a shower and just feeling a lump or bump in that spot. It's pink in color around the margin and has a dark center, almost a fried egg appearance. It's about 1/2 inch in size and has been growing. Our next spot would look worrisome to anybody, but this is in an area of chronic damaged skin, the center of a burn injury that had been present many years and now is developing this ulceration, raised surface, and weeping. It's about 1.5 inches in diameter and definitely a worrisome lesion. This one is just pretty small. It's on a shoulder. It's about 1/4 inch, like a pencil eraser. Just started to change recently with getting raised and feeling itchy. And this one is very common. We see it in sun-exposed areas like this forearm lesion. It's very small, about 1/8 inch, but you can see it also has a fried egg appearance with dark red in the center, then a medium pink to a light pink and white in this area of sun damage. And if you thought any of these lesions were suspicious, again, you would be right, because each and every one of them were squamous cell cancers. This would be a medium grade type skin cancer, one that we would want to remove with a clear margin so that your risk of recurrence or regrowth would be minimal. I'd like to show you a patient of mine who recently had a squamous cell cancer on the scalp. You can tell he has very thin hair. He is very fair skinned, and this area is one that's often exposed to sun damage. He developed this rapid growing ulceration on the top of the scalp, and it was excised with a good margin of healthy tissue. The closure, as you can see on the next slide, shows at 7 weeks a very thin line, very nicely healed area, and then at 7 months. The scalp does have a little bit of tension, so the incision was a little widened on the top, but very well healed for this patient. He also has a seborrheic keratosis, that dark patch. Nothing alarming about that on physical exam, does not need to be excised, but is something we will want to watch over time. So the pre and post-op from this patient shows a good result. Again, very exposed area of sun damage, one that you can't really see yourself, and good skin screening would be very helpful in avoiding these bigger lesions.
Another really common question that we get asked, and I'll ask you, Dr. Lazzaro, what are some of the risk factors that can make you more prone to skin cancer, and is it preventable?
I think that's a very common question. And I think the basics starts with good skin care. A lot of companies want us to support their products, and we ask, well, show us the science. And often there is not science. The skincare products we use at our MediSpa and promote are science-based products. They're excellent skincare. They have the strongest exfoliants. We incorporate sunblock into it. So keeping your skin, and prevention is often stronger than cure. Keeping things in good shape and following closely makes the most sense. And basic things like staying out of sun, or if you're in sun, using a good sunblock, which the other thing we like about our skincare program, a sunblock is incorporated into it. Use the cover up. Most plastic surgeons, including Dr. Camp and I, are not fans of tanning beds. This also will make you more susceptible to developing a skin cancer. And last but far from least is do skin screenings. Come in and see us. Let us take a look at it. We can look at areas that you may or may not think are dangerous, and most of them aren't, but we can follow it. We'll take photographs and see you periodically and check on the progression of it. And I think that's the best preventive measures.
That's great information. And I think a lot of people don't know that when you're out in the sun, you really should be applying your sunblock every 2 hours. And it's not having any kind of an SPF in your makeup, it's typically not enough. You want to have a good SPF on. You can have some extra coverage in your makeup as well. But if you're out in the sun, you really do want to make sure that you're reapplying.
There are some additional risk factors of skin cancer, and some of those can include just your pre-existing moles, which we know with sun damage, a pre-existing mole has a higher incidence to turn into melanoma. There can also be a genetic link for family members like mom, dad, or grandma, grandpa that had melanoma. You may be more prone to developing a melanoma in your youth with pre-existing moles. So let's delve into the worst cancer of all, which is called melanoma. It's also a skin cancer. This screen shows us on the top row of pictures lesions that are normal, meaning they are benign, they're not cancerous. These can have different shape, size, color. They can be flat on the skin, or they can even be raised. As long as they're uniform throughout their shape, throughout their surface, a physical exam would help us to understand if they were suspicious for being something bad or recommending a biopsy. These normal lesions can also be in areas that are frequently injured, and for those reasons, sometimes insurance lets us take them off also. We see the counterpart on the bottom row of pictures, which all are melanoma lesions. And let's just talk about these features. When we look at moles, the A stands for asymmetry. A normal mole would be symmetric. You could cut it in half. It would look the same on both sides. The bottom lesion shows a melanoma with asymmetry. There's an irregular border on the melanoma, which stands for the B, where the top border is smooth in its perimeter. And even though it's a little bumpy on the surface, it's really cobblestoney, which is a normal surface for moles. The one on the bottom shows some ulcerations that are starting to happen. And this surface or border on the surface of the lesion is abnormal with ulcerations. Color is the third feature. Normal nevi have one color throughout, a uniform color. It can be pink to brown to dark brown, as long as it's uniform. Sometimes we even see moles that are very dark, and we could call those a blue nevus. A blue nevus is usually benign. Sometimes they can degenerate into cancer, and sometimes we can have a look-alike that looks like blue nevus, which really can be a melanoma lesion. These can range in size from very small to as large as your fingernail of your little finger. But one color is typically considered a benign feature. If, as on the bottom picture, we start to get multiple colors or a fried egg look, this is an abnormal feature for color. The diameter of normal mole should be about the size of a pencil eraser or smaller, about 1/4 inch, where the one on the bottom is much larger than 1/4 of an inch. And then last would be evolving, or lesions that are changing. Normal moles are there for a long time. They look the same, they feel the same, they don't behave differently, where the lesion on the bottom is showing signs of change. There's actually a new baby that's growing off the top of that central mole. That's an abnormal growth pattern. It shouldn't become itchy or sore or noticeable when before it never was, and now it is. That's an evolving lesion, one that should be examined and possibly considered for biopsy. So let's look at some of these lesions.
Dr. Camp, may I ask a question?
Certainly.
All of the lesions that are in the normal category here seem like they're all raised, and the ones that are under melanoma are flat. Does that mean that if they're raised, they are not dangerous, or can raised lesions also be a danger?
Very good question, Brianna. When we talk about the feature being flat or raised, both of those dimensions are considered the border. So if a border is smooth on its flat dimension, meaning the perimeter of it, that is more of a normal feature. Even if it's a raised lesion, it can be normal with the cobblestone surface. But when we look at the border on the bottom, where it's irregular or undulating on the two-dimensional view, if it's raised or ulcerating in the middle, that also is an abnormal border. So flat or raised is just a feature. We would look at that as either normal or abnormal given its features throughout. So cobblestone uniform surface is more considered normal even if it's raised, where ulcerations or lumps and bumps throughout that are not uniform would be considered abnormal for border.
That makes a lot of sense. Thank you for clearing that up for me.
So this next lesion, you know, somebody would look at this and say, oh, that's a blue nevus. However, if you look at the features that we just went in detail about, this mole, even though it's small, it is asymmetric. Its border is irregular. It's starting to have growth onto the right side. It is starting to show difference in color, dark in the middle, light brown at the edge. The diameter is small, so this is okay, but it is evolving or starting to grow. So all these features, out of the 5 we're looking at, 4 of them are abnormal, and this would be a lesion recommended for biopsy. Our next picture shows one that really does look suspicious. This is on a distal thigh, light hair bearing skin around. There's a little pink hemangioma, or what we call strawberry hemangioma at the top right. This is a normal skin finding, but the dark brown central lesion that has the brown growth off to the left, this is very irregular. It is asymmetric. The border's irregular. There's multiple colors. The diameter over 1 inch is far too large, and it is evolving or changing. So all 5 features are abnormal on this lesion. Definitely would recommend excision. The next one, I'm going to let you look at that. We have a ruler for your judgment as to size. Look at the symmetric change, the border, the color, the diameter, and determine what you think about that lesion. Our next picture shows examples of melanomas. We can see on the far left, the color doesn't have to be black. It can be dark brown, fading to pink, and then normal skin color. The central picture shows what we call a halo nevus, or where the immune system is fighting off that pigmented cancer in the middle. And still it has a growing border to it. And then on the far right is also a melanoma that is just pink red. There's irregular border and asymmetry. All the features of worry and concern are noted in that far right lesion as well.
Dr. Camp, if somebody is diagnosed with melanoma and has it removed, how often would you say that they should have skin screenings done to follow up on either that or any other lesions that they have?
Well, when we talk about skin screening, that would be an exam to assess and predetermine if biopsies should be performed or excisions should be performed. Once you've been diagnosed with cancer, your follow-up exams would be considered surveillance, where we're monitoring your existing moles or lesions or any new that may develop. If you were diagnosed with melanoma or a pre-melanoma condition called dysplastic nevus syndrome, we would want to see you every 3 months, at least for the first year, and then we would consider twice a year after that or every 6 months. But these are changes that are worrisome, concerning, and we would not want them to grow too much before we intervened with a biopsy. So melanoma, we'd put you on a very rigorous follow-up. So this is a lesion on a forearm. It's less than 1/4 inch. It's slightly asymmetric. There's some growth pattern developing off to the right. There's some nodularity over the surface. Even though small, it is changing or evolving and would warrant a biopsy. Our next lesion is one that is on a patient's back. This is one you wouldn't be able to see unless you were doing a mirror exam on yourself or somebody else was observing. This is large, about 1.5 inches, and certainly showing a shadow of pigment change off to the left. The next lesion is on an abdomen. Very fair light skin, a dark nevus that could have been present for a long time, but now showing asymmetry, irregular border, multiple colors developing, that degradation of color in the middle, the diameter now 1.5 inches large, and is starting to change. The next lesion is also on a back. Very irregular, asymmetric, multiple colors. Diameter is 1 inch, so larger than normal diameter. And it is also changing. One, again, you wouldn't really follow closely unless you were aware or had a skin screen and it was pointed out to be observed very clearly.
Would any of these other lesions that are surrounding that be dangerous?
I would say that most of these on this view appear to be what we would call a seborrheic keratosis, just small patches that can be itchy or slightly irritated. The one that's just above and to the right looks like maybe it had been scratched with a small scab on it. These would be observed closely. If they were suspicious, like the one with the little scab, would be removed at the same time for testing. And then we'd be able to tell if it was something irregular, abnormal. This is a pretty common appearing large freckle, as some people would say. This is on the back of a thigh. It's about 2 inches in diameter. It started to change with this central color getting very dark from the top to the mid portion. All the features we look at, those are all abnormal and would warrant at minimum a biopsy.
So Dr. Camp, now that we looked at all of these, a common question when people come in, how exactly is this procedure done?
So depending on the evaluation, biopsies can be performed in different methods. If we show the next picture, Brianna, this is an example of a pigmented lesion. We would most often excise this with a scalpel, remove a full thickness with a narrow border of healthy appearing tissue, and require suture closure. We would send this tissue off to the pathologist for sampling, have a report back when you came to get your stitches out. Sometimes lesions can just be shaved biopsied where no sutures are needed, but you would have a little raw patch that would heal over the course of 12 to 14 days. A shave biopsy would not be a full thickness of skin and therefore would not need to have sutures. However, if you leave lesions unattended, you say, oh, it came and then it got better and it came back again in the same spot, I think it's okay. If you leave them unattended, they can grow under the skin until they develop larger changes. And our next picture shows someone who, in fact, waited a long period of time to have her lesion taken care of on the forehead. It started out very small, like what you see on the right forehead, and then expanded over time. It required a much bigger procedure to take care of this large lesion on the forehead. And the new one on the chin also was larger than what we would like to see to get a minimum surgical removal for healing.
Another very common question, Dr. Lazzaro, is if someone has a lot of moles, should they be concerned?
Well, as Dr. Camp so astutely pointed out, you can have lesions that seem like they're perfectly benign that potentially could be something else. So I think it is beneficial to have an expert take a look at it. So there are medical reasons to do this, but there are also aesthetic reasons to do it. Some people may not be, they're not concerned that this is something dangerous or they don't know, but it also aesthetically isn't attractive, and as well as just wearing clothing irritating it, necklaces, or bothersome. So these can be taken off, and oftentimes without an incision at all, with just taking them off at the skin level, and give a very nice result. And depending on what type of insurance you had and what their coverage is, many times this is covered by insurance and sometimes not.
That's interesting. I know after looking at all those pictures, I'm looking at my arm and where I have freckles, and I'm thinking I need to get in for a skin screening just to make sure I'm okay too.
It gives you a peace of mind. Absolutely.
Yeah, definitely. Now, as we touched on a little bit earlier, we saw that we can do cosmetic procedures and remove lesions or moles as well. And I know you have an example that you wanted to show us.
Well, let me show you. This was an interesting case for a number of reasons. This is where primarily he came in to have the lesion checked on his lower eyelid. And if you look closely on his right lower eyelid, he has a plaque there. Now, we're going to see this look like a benign lesion. There was no pain involved or bleeding. So what we're going to try to do is shave this off, take it off without making an incision, because we don't believe it's a cancer. So we're going to take it off at the level of the skin. And this is a very delicate area. Your eyelids are the thinnest skin in our body. So we did take that off tangentially and send it off to the pathologist, and it was benign. I think we have a picture of him next showing that. This is approximately 2 weeks, 10 days after that. It was totally benign, and he was very happy and relieved that this was benign. But then he brought up, you know, I have a tired look on my face, where he has that tear troughing, and he says, is there anything we can do about that? Well, taking the lesion off was an insurance procedure, and now we know that's fine. But now aesthetically, if we want to change that, we've did on this gentleman something that is one of the newest and most exciting thing in plastic surgery, where we can take fat out of another part of his body where he doesn't want it. Most people can direct you to some location there. And then without making an incision, through a needle prick, filling that area up and blending it with his cheekbones to make his cheekbones a little fuller and blend across the area of the eyelid. Simultaneously, we'll do a surgical chemical peel to tighten the skin of the lower eyelids. And now let's show you a picture of him at 2 weeks afterwards. He's still a little pink, but you can see it gives him a more balance to his face. He gets a more refreshed look. And again, the little pinkness, women can cover that easily with makeup, and gentlemen, when we talk to them about it and show them how to do that, they can do that as well. But he gets a much more rested, refreshed look to the face as well. And that's him on a 3/4 profile. On the left, before he had his lesion, right after the lesion, and then placing that the fat in there, which incidentally is permanent, where we can put that in and 2/3 of this doesn't go away. So it gives them a nice, long-lasting change.
Well, thank you for all of that great information. I really hope that everybody found this informative. I know I certainly learned a lot about the differences between the skin cancers and needing to get in for a virtual consult. So we should make another date. We are offering everyone on this webinar today a complimentary virtual consultation. You can go to aestique.com and you'll be able to click on the link to schedule. And Dr. Camp can take a look at you, and when we are ready to reopen again, you can come in and see her and she can actually examine it as well. With May, again, May coming up, it's Skin Cancer Awareness Month. So really it's time to really take a look at this, take care of ourselves. And just a sad fact that somebody just brought to my attention is Bob Marley died of melanoma. So if he would have just taken care of himself and had things checked out, he may still be here today giving us this great music that he had. And with that, we're really happy that you joined us. We hope you found this very educational. We will be sending a link out tomorrow where you'll be able to rewatch it again. And please share it. It'll be on social media too. Share it with your friends and family so they can take a look and they'll be able to get a skin screening and something can save their life. So here's our list of social media. Everything that we do is on here. Follow us on Facebook, Instagram, and YouTube. And with that, I'll let Dr. Camp and Dr. Lazzaro say a close.
Well, thank you for your time today. I look forward to meeting you on virtual consultation to just give you a skin screen. If you have any questions or concerns, we are always available. Thank you.
Thank you all for attending today. We are very happy. We're on a positive slide. We'll be back in service next week in May, seeing patients and doing procedures. So stay safe and stay positive. Best is yet to come.
Thank you everyone for watching us. We hope we help you live life counterclockwise. Take care.